Lack of access to information is a major impediment to quality maternal health care in Kenya, prompting social innovators to invest in bridging the information gap. CNBC Africa's Wendo caught up with the founders of Toto Health, a messaging service that sends healthcare information to mothers. Take a look.
Kenya is experiencing slow growth in maternal health care with a mortality rate of 488 deaths per 100 live births. These worrying statistics led to the invention of Toto Health, a social enterprise that uses technology to update mothers on their health and that of their child.
The way Toto Health works is based on the date of birth or the stage of pregnancy of a mother. We've built a system that is able to understand that as a mother you're 6 months pregnant or your child is 2 years old, and then based on that we have the content built, the health content that is relevant to you at those stages. So the system sends you as a text message or as a voice message. So our system, I think the beautiful thing about Toto Health is you don't need to be literate for you to use Toto Health. So just so long as you can be able to read or you can be able to listen, then you're good to go.
We send out SMSs from 5-week pregnancy until 5 years of age of the child. And all those SMSs are being developed within our own team. We use a consultant team to validate our content, to make sure it's credible, it's in line with the guidelines from the Ministry of Health. So we have nutritionists, we have other public health specialists, we have specific organizations, we have doctors, midwives in our consultant team who validate and give feedback on our content to make sure it is good information that we send out.
The application targets the population at the base of the pyramid, where the highest rates of maternal deaths are registered.
We started first only targeting what we call our general population, but then we thought that there are key populations within our society which need to be addressed differently. So that is when we started developing content also for teenage girls who are pregnant. They need different information than an adult. We have the same for fathers. Fathers are a great contributor in reducing maternal mortality. So we adjusted our content to also involve fathers in doing pregnancy and child upbringing. So we tell them how they can support their wife, we tell them what they can expect, we tell them what their role can be during pregnancy. It's not only a woman's thing. Initially
we thought that mothers who are very literate wouldn't be able to register to our system, but then we have mothers who finish university but then still registering to Toto Health, saying that I want to be updated about my child all the time, and every information that is out there that is about my child, I want to receive them. So we have very elite kind of mothers who want to be very much updated about their children, always knowing what is going on with their children, who also register to Toto Health. So as much as our target market is middle class and lower, we also have upper class registered to Toto Health.
Toto Health is currently reaching over 21,000 mothers in Kenya. The platform is funded through grants and investments as well as registered users.
We knew that Toto Health has to be run as a business rather than as an NGO. And the reason is because we want this to be a business that will last for the next 30 years. So from the beginning, we wanted to have a business model for Toto Health. And right now, mothers pay only 200 shillings, which is $2 per year, for them to be in Toto Health. So it's really something really affordable. If you break that down to a month, to daily, something really negligible. So, but with that amount, we're able to sustain ourselves as Toto Health and able to reach as many mothers as much as possible.
The business has a network of over 1,500 community volunteers, recording 92% hospital deliveries of women on the platform, as compared to national figures, which stand at 62%.
The Ministry of Health recommends that mothers attend at least 4 antenatal clinics. As Toto Health, we do 87% of our parents at least finish 4 clinics, which is actually a success factor for us. If you compare the national one, we're talking about 57%, those ones who are not registered to Toto Health.
Toto Health aims to expand into 15 counties and reach 250,000 mothers by 2017, as well as extend within the East African region.
Our aim is to connect every mother in our continent. So that's our big area vision. To be able to connect every mother in one platform. And think about the opportunity once we connect every mother. It means if there is a missile campaign, then Toto Health is the place to use. If the government wants to know how many mothers are about to deliver in a particular area, we are able to pull that data. So the future of Toto Health is actually in data. How much data can we be able to show in real time about what is happening to the community, about what is happening to these mothers? And that's where actually we see a lot of opportunity.